Well,
all right, one moment here. All right, there we go. All right, so like I said, today I'll be presenting on some topics that relate to women's vision and eye health. And thank you again for being here for our monthly Lunch and Learn. So just a little bit about Prevent Blindness Wisconsin. I do see some familiar names here, so I'm sure a lot of you are well aware of who we are, but just to go over again in case some of you are not. We were founded in 1958 and we are dedicated entirely to vision health. And we are the only entity here in Wisconsin that's actually focuses on preventative vision health services, which I think is really cool. We do work with individuals in Wisconsin across the lifespan. So we do work with children, kind of that cradle to grave model. Our goal would be that we could ensure everyone here in Wisconsin that they can see clearly. Some of our partners that help us, ensure that Wisconsinites can see clearly, because we are a very small staff, but we do work across the state. We partner with health departments, shelters, the Department of Public Instruction, school nurses, Head Starts, child care centers, private schools, free and reduced clinics, and then the Wisconsin Lines Foundation as well. A lot of these partners, and some of you I'm sure help us, in this part of our mission, but a lot of our partners help us with sight conservation relating to vision screenings and help us provide vision screening services across the state. To show you our reach, so we did reach over 400,000 Wisconsinites through our public health education during the 2021 fiscal year. We wrap up our fiscal year in early April. So that said, we're just kind of starting to see the numbers or the reach that we had during the 21-22 fiscal year. So stay tuned for that, and hopefully we'll have an updated map at maybe our next Lunch and Learn, so that you can kind of see the reach we had during that time. So today, relating to our lunch topic, we are going to discuss objectives that relate to common vision problems that we see specifically in women, as well as review and discuss risk factors for each eye condition. And then we're also going to talk about how to understand preventative techniques that are available to prevent the onset or vision loss from some of the conditions that we'll discuss today. If you have a question at any time during this presentation, please feel free to chat your question. It is a small group, or if you feel comfortable, you can unmute yourself and ask as well, whatever makes the most sense. Although if there are no questions, this is your lunch hour, so you can always sit back and just relax and enjoy the content. So, women in vision and eye health. So just a fun fact, on average, women do live longer than men, and many of the diseases that are brought on are due just to the aging process. In the US, over 60% of those that are blind and 62% of those individuals are visually impaired women. So just that's how many vision problems we're seeing in women, and then as well as blindness. Common eye diseases that affect women include age-related macular degeneration, so we'll go over that, as well as cataracts and dry eye. Before we talk about some of those conditions, just to highlight the beautiful organ that we're really discussing today, and just that the appreciation to gain before we get into those conditions is the human eye, or the eye anatomy. And really what we like to highlight here is just how many parts make up our eye. And we have two eyes, so that means we have to make sure that all of these moving parts are working well for both of our eyes at the same time. So just something that we really like to, again, kind of highlight before we actually start discussing some of these eye conditions. So the adult eye conditions we'll cover today are dry eye. So with dry eye, this condition is a condition known that when the eyes do not produce enough tears, the consistency of the tears is not effective in hydrating the eye. That's what we consider dry eye. This image is a really good image of what dry eye or how that could present itself, or how someone with dry eyes, how this could look. I actually do have dry eyes myself, so I can testify this is how my eyes look sometimes, and why I need re-wetting drops myself. Symptoms of this particular condition include burning or stinging of the eyes, especially in the morning. We've heard people report when they wake up, they really feel that sensation. A sandy, gritty feeling in the eye. Blurred vision can be a symptom of dry eye, and then excess tear production followed by extreme dry periods is another symptom of this eye condition. What are risk factors for dry eye and how can we actually treat this condition? So as women age, we become more at risk for dry eye. So there's not actually a cure for dry eye, unfortunately, but there are methods that we can use to decrease any symptoms that one might be experiencing if they do have dry eye. So that includes avoiding cigarette smoke. That is extremely helpful. So if making sure we're not smoking and then surrounding ourselves around that as well. Taking fish oil supplements is a good preventative or treatment measure. Using a humidifier in your room just to make sure the room stays nice and moist, especially overnight while we sleep. And then using over-the-counter artificial tears or ointments. But we really only recommend that if your optometrist or ophthalmologist provides this treatment, or prescribes rather. But again, I do use artificial tears. They were prescribed by my eye doctor, and I do find that personally really helpful to aid in the dry eye that I have. The next condition that we'll cover is age-related macular degeneration, or AMD. So how this condition can present itself. So we see a beautiful plain field without any vision problem. And then now what this could look like with a person, or how someone who has AMD, how they could see this same picture. There's actually two types of age-related macular degeneration, or AMD. The first type is dry AMD. This is actually the most common form of this eye condition. It can result in permanent vision loss over time. And this is a result of a buildup of drusen. Drusen is known as a small protein deposit that does develop underneath the macula of our eye. So the macula here is located in the back. So if we do have protein deposits that are building up there, that is a form of AMD or dry AMD. The second form is wet AMD. This is a more serious and rare form of this eye condition. It results in severe vision loss, but very quickly. So what's happening with wet AMD is there is a formation of abnormal blood vessels that are growing underneath the macula of our eye. So anytime we associate new blood vessel growth inside of our eye somewhere, that oftentimes is associated with severe vision loss or a more serious type of an eye condition. What are risk factors for age-related macular degeneration? Aging, so getting older puts us at a risk for this eye condition. If we have a family history of this eye condition, race, gender, hyperopia, or being farsighted, and then smoking too puts us at a risk. The next condition that we'll talk about this afternoon is cataracts. So how this cataracts presents itself, or how one who has cataracts might see the world. Again, we see the beautiful plain field, and then how a cataract could make the same picture look. So we can definitely make out what we're looking at. It's just less clarity, almost like there's like a sheath over what we're looking at. So what is a cataract? So a cataract, so normally we should have a clear lens over our eye that helps us focus, on images really sharply. If we do have cataracts, then our lens has become clouded over time, and then in turn that cloudy lens prevents us from focusing on things sharply, but instead focusing on things a little bit more poorly. There are 4 types of cataracts. There's age-related cataracts, so cataracts that develop over time as we get older, congenital cataracts, cataracts that we're born with, traumatic cataracts, so cataracts that can develop because of maybe an eye injury or something else traumatic, and then secondary cataracts as well. Next, we'll cover diabetes-related retinopathy as another eye condition. So the beautiful field, again, no vision problem, and then how this same picture could look if we do have diabetes-related retinopathy. So we see a lot of kind of floating objects now at this same picture. So with diabetes-related retinopathy, what is retinopathy? So the retina of our eye can over time become weak due to fluctuating blood sugar levels. Especially if we, have diabetes and it's gone uncontrolled for a long period of time, we can be at a risk for getting this particular eye condition. So over time, those fluctuating blood sugar levels can cause the blood vessels in our eye to become weak. And then in turn, because those blood vessels are weak, they can start to leak and break open. So then we have some, unnecessary fluids kind of floating in around the eye. About 1 in 3 people who do have diabetes and are also 40 years and older, they already do have some signs of diabetes-related retinopathy. So that's why we really encourage, whether, anyone here has diabetes or, when we're working with individuals who do have diabetes, that they're going in for a dilated eye exam annually, just to make sure that this isn't happening inside of the eye and to conserve vision over time. Different risk factors for diabetes-related retinopathy include, again, that diagnosis of diabetes. So that's why, we want to make sure we're going to the eye doctor. Just like I said earlier, if we have diabetes or if anyone else that we're working with does, race and ethnicity, gender, the duration of disease, so how long we've had diabetes. And then actually diabetes-related retinopathy itself can become a risk factor for cataracts and glaucoma. So 2 other vision problems that this particular vision problem can put someone else at a risk for. Moving on from those vision problems, so pregnancy and vision health. So next we're going to kind of switch gears here. So frequent fluctuating blood sugar levels and hormones. So that can happen while we are pregnant. So the placenta that comes with baby can cause these changes in blood sugar levels and then hormone levels in our body. When we are pregnant, we're at, or that change rather in blood sugar levels and hormones can also cause an increased risk for other vision complications. Diabetes-related retinopathy, so women that have diabetes, blurry vision, puffy eyelids, and migraine headaches, and then a sensitivity to light. So it is recommended that women who are in their first trimester of pregnancy do receive a dilated eye exam, primarily if you do have a diagnosis of diabetes or pre-diabetes prior to becoming pregnant. Women who are treated for glaucoma, it's important that you do tell your doctor that you're pregnant or that you intend to become pregnant, just because if you are on medications to treat your glaucoma, we want to make sure that's not affecting baby. Makeup and vision health. So there is a huge link to makeup, especially eye makeup, and our vision. So due to makeup's common use, and then again, that close proximity to the eyes, makeup can have damaging effects on vision health if it's not used properly. Common vision concerns that can be associated with makeup include corneal scratches, allergic reactions to specific eye makeup products, and then conjunctivitis or pink eye. So some tips, because, wearing makeup, it's fun to do, especially if we're going out, it's a special occasion. So we don't want to totally not use it because because we're worried it might cause a change in vision or might affect our eyesight. So there's some tips that we like to suggest to make sure that, makeup won't affect our eyesight. That first tip is don't use expired makeup. So that's a big one. So similar to food, makeup does have an expiration date. So the longer that makeup sits, the greater its chances of forming bacteria. So all makeup products actually have an expiration date on the back of the package. I know that I've been with Prevent Blindness Wisconsin. I'll be going on my 6th year, but I'll be honest, before I really started to get into this area of our health, I didn't really look at that expiration date. So I'm not sure if any of you, if you do wear makeup, if you're doing that, but I would highly encourage you to and look for on the back of the packaging, imaging, just like you're seeing on the back of on this slide, just to check that expiration. So look for the label on the back of your makeup. So you'll see 3 months, 6 months, and so on, just to determine that the expiration date from the date that you actually open the sealed package, that it's still current. Eye makeup, including eyeliner and mascara, that should be replaced. We recommend every 4 to 6 months. And then eyeshadow as well, just because that's coming close to our eye. Eyeshadow actually has a longer shelf life, and that can be replaced every year. Tip number 2, when we're dealing with makeup, is do not share your makeup with others. This is a very guaranteed way to, cross-contaminate or share germs and bacteria with others. So your makeup should remain your makeup only. And, when we're working, especially with like maybe high school age students that we'll do public ed with, this is a big tip that we like to promote there, just that they're not sharing it with other students. So if we do share makeup, that can be a huge factor in the onset of conjunctivitis or pink eye. When we are applying makeup, it's really important to wash your hands before you actually apply any makeup product to your eyes or even your face. So keeping those hands clean before we have the makeup application. Tip 3, so wash your makeup off and throw it away if you notice any irritation forming in or around the eyes with a certain product. Make sure you just get rid of it. We do not recommend that you just kind of see how things, if you have that same reaction the next day. And if irritation does persist, worsens, then we highly recommend that you seek medical attention, just to make sure that, you don't have that severe reaction and that it might lead, in case it would lead to something much worse. So tip 4, always remove your makeup, primarily eye makeup, before you go to bed. So that's also a healthy tip we like to promote. So even if the tiniest fleck of eyeshadow or mascara gets in your eye, that can actually cause an infection. So make sure you're removing that makeup every night before you go to bed. Our 5th makeup and vision health tip is to always remove, is to avoid natural and preservative-free products. So bacteria thrives in these products. So to reduce any chance of allergic reaction, we really recommend that you use cosmetics labeled fragrance-free, hypoallergenic, or for sensitive skin. Tip number 7, do not carry mascara in your purse or leave makeup in your car. So cosmetics should be kept away from any type of extreme weather, especially extreme heat or cold, that can break down preservatives. And that breaking down those preservatives, if we keep them in one extreme temperature, is a good breeding ground for bacteria. So keeping those products out of the car, out of your purse, and so on. And do not apply makeup while you're driving or while you're in a motor vehicle. Might go without saying for some of us, but I have seen individuals, on the road and they're trying to put on mascara And that's just not a safe option, again, especially while we're controlling a motor vehicle. So healthy vision and lifestyle factors. So what can you do to, ensure again that you have healthy eyesight, especially as a woman? So maintaining good blood sugar levels if we have diabetes or pre-diabetes. If you have hypertension, making sure that you're controlling that disease. If smoking, avoiding smoking, any kind of smoke, cigarettes, e-cigarettes, and so on. Avoiding alcohol or over alcohol consumption. If we are pregnant, to make sure that we're getting a dilated eye exam, especially in that first trimester of pregnancy. And a lot of women report that they have a vision change when they become pregnant, again, because of those fluctuating hormones. So that's really important to get a dilated eye exam at that point to make sure that you're seeing as clear as you should be. Eye injuries, so keeping your eyes safe from any type of injury. If you have disease processes that put you at a risk for different vision problems, to make sure that, again, you're keeping up with that routine vision care to make sure that you, once again, are seeing clearly, and that maybe one of those disease processes isn't putting you at a risk for another or any type of vision change. And then those safe makeup practices that we highlighted on this afternoon. So making sure that your makeup is not expired, making sure that it's hypoallergenic, you're removing it before you go to bed every night, eye makeup, face makeup, and that, again, you're not applying it while you're driving a car or anything else that could be an unsafe situation. So all good lifestyle practices that we recommend that you follow, again, to keep your eyes the most healthy that they can be. So with all that, a big thing we always want you to take away from our monthly lunch and learns, and just anyone who knows any of us from Prevent Blindness Wisconsin, we can promote this till we're blue in the face, but just that you're getting a routine dilated eye exam to make sure that, again, we have healthy vision, we're seeing the most clearly that we should be, and that all parts of our eye are working together and they are healthy. Early on when we started this presentation today, we talked about, and I kind of showed you all of those small moving pieces that we have to make sure are healthy. So if you do opt out of a dilated eye exam, the eye doctor can still see the back of your eye and most of your eye, but it's just a much more narrow snapshot. When we dilate that pupil, it just really opens up the view for that eye care professional to see and to make sure, again, that the parts of our eye and that we're seeing things clearly. So the dilated eye exam, especially as we get older and especially as we, grow into adulthood, that dilated eye exam is extremely important. So with a dilated eye exam, here are the recommendations. It is recommended that those that are not considered at risk for vision complications, that they receive a dilated eye exam about every 2 to 4 years is a safe window. If you are at a risk for vision complications, including anyone 60 and older, African American and Hispanic Latinos over the age of 40, adults that are diagnosed with type 1 or type 2 or pre-diabetes, or adults that are diagnosed with vision concerns or eye diseases. If you do fall into one of those categories, it is recommended that you receive a dilated eye exam once a year or annually. And preventing eye diseases, prevention care is very essential when we're talking about sight conservation or making sure that your eyesight is healthy. So maintain a healthy lifestyle. I know we talked about some factors that can really help you lead a healthy lifestyle and maintain healthy vision. But a big thing is, remember, do not smoke. Smoking causes a huge detriment to our eye health. So just make sure that you are not smoking, or clients that you serve, that you're also mentioning that if you are working with them and talking about their vision health. And getting regular dilated eye exams as recommended by your doctor. Educating yourself about different eye diseases and the risk of getting them. Anyone who is here this afternoon, you're already kind of doing that by attending these lunch and learns. And then just a huge reminder too, that your eyes are precious. You only get one pair and no spare. So if you can take that away from today's conversation, then I think you're in good shape. And to kind of round out our education for the afternoon, if you would do us a favor, and if you don't already, we are always looking to expand our followers on social media. So Facebook, Instagram, Twitter, and LinkedIn. We do post a lot of really cool public health ed pieces. Again, if you don't follow us, or if you do, maybe you've already noticed some. And we also highlight a lot of our partners screening in the communities that they serve. So if you have your phone out, or if you use any of those social media platforms, please follow us. All right, I'm going to stop sharing. And then does anyone have any questions before we wrap up for the afternoon?
No.
All right. Well, thank you, everyone. I will follow up with an email. And as always, it's been a pleasure chatting with you, and thank you for spending your first 30 minutes of your lunch hour with Prevent Blindness Wisconsin. And I hope everyone has a great start to their week, and happy April 25th.